I'm David Mason, the Director of Public Health for the town of Sandwich, and I'm with Chief Burke today, and we're doing the Delta Wave PSA number 2. And we'll be going over some updates on cases, masking, vaccination, and whatever other issues we feel, because Chief and I were just talking about, you know, the summer, the heat and what it brings, and just maybe we have a hint or two, you know, to go along with at the end of it, just to make it different. So we'll, as we always do, we'll start with Chief Burke for the update on caseload.
All right, thank you, Dave. As of today, we have 30 active cases. We have 1 resident that is hospitalized, not in the ICU at Cape Cod Hospital. So the numbers are kind of where they were at midstream, I would say, in the spring. You know, in the March timeframe, we were seeing about, 24 or so cases. But that's where we sit as of today. Hospitalizations are down, though, so that is the positive.
And we've been seeing, just even in the state, too. I mean, I think there's been a couple days we're up to 1,000. I think there was one day that was 2,000 or something.
I think the 2,000 was the 3-day weekend average.
From the weekend, the carryover.
And I think I tell people that you got to be real careful with Monday numbers, both nationally and locally, because most places are not reporting now on the weekend.
Yep.
So I think
divide that by the number of days.
Divide by 3, and I think the 2,500 or so that we saw in Massachusetts, that number still was around the average of 800 or 900 a day. So we're still well below where we were at the peak.
But above where we were in June,
correct.
July.
Yep, we were at 100 or 200.
Because we had days that were zero in the state,
yep.
As far as that.
Yep.
So, okay, and then, so I guess we'll speak to masking. I know we had talked the last time. We talked about an infection rate of 3%, and if we go over 3% in the county, we should really talk about masking. I mean, we hit that. We're at 4.8% right now in the county. So I think I'm putting it out there that we're having a strong advisory if you're, to wear masks indoors. We're not making it a mandate. It's an advisory, and at the same time, it's a common sense advisory. If you're going into a crowded store, carry it with you. Mask up as far as when you go into those situations. If there's not a lot of people and you're social distancing, not so much. You just kind of have to use your common sense for the situation we talked about in the past of protecting your space. I mean, I'm going out into supermarkets with my wife. We're masking, at this point, because of immune compromised issues, and I will say that the public health nurse wanted me to emphasize today, if you're immune compromised, wear a mask. Okay, and what you had mentioned in the past, what do you have your guys doing also, Chief?
So in the station itself, they are not masked. I have about a 98%, 97% vaccination rate at the station. But on all calls, they're masking up, and they're going even higher end at 95 and PPE for their congregate living. So your nursing home, Spalding, those facilities that have congregate living, they're going another step up. We were also testing the few unvaccinated members that we have are tested every shift with a rapid antigen test. And we're also looking at even our vaccinated folks, when they even have a symptom of a sniffle, they're testing, and some are just voluntarily testing every first shift that they come back to work. So we're trying to stay on top of it. And again, it's we have the testing ability, so we're going to utilize it.
Yeah, and that's, and there's an example. You have the controls in place, and you have the tools, to put those controls to really monitor it. So as far as, your guys, they all know each other as far as habits and their vaccination status and all of that. So to put those tools in, it's a safer environment at this point. Whereas the general public, you go out to a crowded bar, or a store, just use some caution, and depending upon your own medical status also, to use some caution on that. Would you agree with that?
Yeah, and I think it's to emphasize also the way our stations, luckily, and thank you to the voters for the new station on Katuitt Road and the renovation in East Sandwich allows for individual rooms for our members when they are sleeping. And that's a huge aspect to this. We're able to isolate our personnel pretty regularly. When they're in the ambulance, that's a different story, but I think having the ability to isolate them in the 3 stations, keeping the control measures in place, having the testing platform available, the vaccines available for those newer members that come on that may want a vaccine. I think, so far so good. We're in pretty good shape.
Yeah, and that was the drive from day one of this whole thing, was to protect that infrastructure, those people that are necessary for the rest of the community. So
agreed.
It's worked out well. And as far as vaccination, again, to put it out there, the school Superintendent Gould has put out an invitation there to anyone of age 12 or older in the school communities to get vaccinated on the 26th. She's still collecting names and numbers for that. We're looking to get over 35 people to make it worthwhile for the state. I know she's opened it up to some surrounding school districts, and we'll have an update on that probably by the end of this week to whether we're moving forward or not. And I think it's good to open it up to the surrounding communities, especially with the schools. If you think about it, the schools, school sports. I mean, I think there's this thought that, well, what we do in town here is just, to protect in town. But I mean, there's no wall up around our borders.
Nope.
There's no fence. With the school sports, we'd end up interacting with other communities, and thus the potential for transfer, and that's why we're willing to help all the surrounding communities also. As we did with, as Chief Burke had arranged with the police and fire also, because, all of them are dependent upon each other for secondary response. Is that the correct term?
Absolutely, yes.
So, I mean, there's a huge benefit to that also. It's the same process at this point. So I think as far as, I know there's a lot of questions on the masking with regards to schools. There's emails being sent on it. I mean, it's a national discussion at this point. If you look at Texas, when they removed their masking mandate, they started to see that creep up in cases 2 weeks after that. There's a lot of information out there on both sides, of what direction to go. But in the end, the decisions that will be made, I mean, the superintendent is communicating regularly with the state and other superintendents, and we're all looking into the issue and how best to address that, and we have some time. And I know just before, we always have our predictions on the way numbers are going, and I had brought up last time where Chief and I were just talking about in April when we had the highest trending case rates for variants, and we made all these plans, and we can all we can do is plan, and we put the measures in place for testing and control, and the rates just dropped off, and that may happen here too. So any thoughts on that, Chief?
Yeah, I think that's what we talk about, predictions and watching patterns. I think I'm curious if it runs an 8-week cycle, and it seems like that's what's been happening. And so I have August 31st circled on my phone. When you take the July 1st, roughly P-Town breakthrough cases, and you run that out about 8 weeks, we're going to be just around Labor Day weekend. And I'm curious to see 3 weeks from now if the numbers are down, and it would follow a similar trend to the April vacation, and then what we're seeing in other European countries also, where it seems like it's a 2-week ramp up, it's a 4-week accelerated case count, and then it's a significant drop. And the way I look at it is that steep vertical climb that we're in now has a steep drop off, whereas before we had the slow rise and the slow descent. So I'm curious to see, again, with the Delta variant, what this looks like, come August 31st and as school starts. And you're right, don't make decisions now. Let's let it play out a little bit and see. I think that's a good strategy. I know some people want the answers now, whether mask or to unmask. But I think one of the things we've learned through this whole thing is to be patient. And don't rush to judgment or don't make any rash decisions. And I think that's what we're looking at. Let's let this play out for another couple weeks. Let's see what the numbers look like at that point, and then an educated decision can be made.
Yep, on the best information available. Correct. At that time. And even the decision made at that time does not represent, we'll speak to the masking for schools, does not represent the decision for the entire school year.
Correct.
It is fluid, so it represents a decision for that moment in time, and we'll still be evaluating it day to day, week to week at that point, to watch what the trends are and the direction things are going.
Yep.
So, All right, so I think, anything else going on this summer, Chief? I mean, we were talking about with the heat coming and perhaps we're seeing a level of anxiety out there. and what our station person here, Alex, was stuck behind two accidents. What else are you seeing? And I'll tell you what I'm seeing.
Yeah, so it's interesting. The call volume is way up significantly. Now, July started off average. But just to put in perspective, I think it was Sunday, I posted on my own Facebook page, we had done at least 20 calls, 3 different multi-trauma calls, 2 med flights, the third we called for them, they weren't available. All 3 different types of calls, and we're seeing just a significant, it could be tourist driven, it could be the population influx that we get in the summertime, but even the first 11 days of August, we are way above where we normally are. We could do 600 calls in August, which would be, when the fire department first started in 1975, when they were 73, when they were full time, they did 600 calls in a year. We're looking at 600 just for August, which is significant.
Wow.
And it's all walks of water rescues, the multi-trauma that we're seeing, and a lot of, and this speaks to a lot of what's going on, psychiatric calls are a significant uptick in those. And it's impactful to the organization. The guys are, the men and women are working very hard. And
it's tiring.
It's tiring.
Emotionally, too.
Emotionally, when we have 3 staffed ambulances and a 4th if we can get coverage. And I can count in the last week, I've sat in my office and the deputy and I have been the only people left in town with all 4 ambulances out. So it's, it is a significant push. The heat wave that's coming will be interesting in the next couple of days.
Yep.
I will let people know that, and I give credit to Sue Morancic and Brian Gallant, our folks in emergency management and COA. We did a cooling center drill the end of June at the COA. If there was an issue where seniors needed to be cooled down, we ran through that whole scenario with pandemic protocols in place. And remember, June 25th, when we did it, the numbers were almost at 0. But we ran through it anyways, just in case. And I think where we're at now is if cooling centers need to be open over the weekend, everybody will be notified. And just know that if you're going to a cooling center, we're not going to ask if you're vaccinated or not vaccinated. We're going to put you in a place where you can get cool, where you're socially distant, and all your needs are going to be met. And I'm very happy that we took the initiative to do that at the end of June, because with this heat wave coming up, we're in a place where we can feel comfortable opening a center and maintaining the social distancing and pandemic protocols that we need to.
Very good. My suggestion too is going into August, September, we're receiving the arbovirus reports relative to mosquito diseases, and they're starting to creep up again. And then as far as this humidity and the rain, if you have any containers in your yard, dump them, turn them over, keep them as dry as you can, as far as keeping your grass low, because we're starting to see an increase in those issues. We were talking about this before we started this, bats. Yeah. As far as we had a resident with a bat in the room and how to deal with that heat coming. Bats tend to try to get out of those areas and into cooler locations. So just have an awareness of that. If you encounter a bat, if you happen to be sleeping, if you can hold the bat, because we can always have it tested instead of getting your shots for rabies. Just something to be aware of at this point. So those are our suggestions beyond COVID at this point. Anything else we want to add?
No, I think we're going to discuss having another update next week. I think we're going to do weekly updates for the next foreseeable future.
Going into the school year, because I think there's a lot of people also, wondering what's going on, and we can give you a better idea as far as what's happening, and just, to basically give the information for the justifications for whatever decisions are made.
Correct.
Coming forward. So, all right, so I think we'll sign off with that. Again, be safe out there, be respectful of others. Take a deep breath in the heat. Go about things calmly. Keep Chief's numbers down if we can. So we'll talk to you soon.